Hello guys, this is the new channel and I would like to get support from you. So if you like the channel or the video, just press the like button, share the video, subscribe to the channel and press the bell icon to all the updates about the new videos. Thank you. So we'll start now. The lecture is on history taking. So this is the doctor-patient relationship. This is very important. Now, 8 points are to be remembered in this. These are particulars of the patient, chief complaints of the patient, history of present illness, past history, drug history, history of allergy, personal history, and family history. If the patient is child, the immunization history is to be taken. Particulars of the patient are very important. Name is one of the ways to identify a patient. Anyone would like to be known by the name. So the doctor is asking, how are you feeling today, Mr. Thompson? So patient will feel good if you take his or her name. Age is also very important in history taking because some diseases are age specific, like congenital anomalies, for example cleft lip, cleft palate. An infant intussusception and Bill's tumor are more common. So infant and children, you can say these are common things. In adults, appendicitis is very common, and in old age, carcinomas and benign prostatic hyperplasia are very common things. Sex of the patient is also important. So thyroid and cystitis are common in females. The carcinoma stomach, lung and hemophilia are important in male patients. Religion plays a role. CAPNS and phimosis are hardly seen in Muslims because there is ritual in which there is circumcision at the time of birth. Social status also, tuberculosis is common in lower socioeconomic status. See this, I have uploaded this picture just to show you the overcrowding, nothing else. So in lower socioeconomic status group, there is overcrowding and tuberculosis is more spreading. Occupation is also important role because varicose veins are more common in bus conductors and urinary bladder carcinomas are common in dye factories. Chief complaints, it should be noted in chronological orders, like which appear first. You should also exclude the irrelevant talks, like if the patient is having flight of ideas, you will feel like this, what is he saying? So the chronological order is pain abdomen for 7 days, vomiting for 5 days and non-passage of feces and flatus for 2 days. So first incidence reported first. Very important to ask the patient that he was perfectly alright before these symptoms. That will give the clue to the diagnosis. The residence is also very important, like filaria, Anodis, peptic ulcer in northwest, Kangri carcinoma in Kashmir. So this is lady is holding the Kangri and you can see this here. It is touching the body surface and this is causing burn and leading to Kangri carcinoma. And history of present illness is also very important since beginning of the first symptom till the time of examination is covering the history of present illness. What you do in this you explain the chief complaints which you have noted in chief complaints. So mode of onset, if there is pain, was it sudden or gradual? So are there progression of symptoms, record in patient's language. So patient language is very important. That will be easier to explain. Avoid leading question, because if you leading the question, then patient will definitely have some answer for that. Negative answers are also very important. Now a negative answer is like if you are having a fever, if he says yes, it's positive answer. If he says no, it's a negative answer. Past history also plays a role. Disease suffered by the patient in past plays a role. So diabetes, very important. Tuberculosis is important. Asthma is important. Hypertension is important. And history of previous surgeries is also very important. Drug history, now that is important for anesthetic purposes, may help in present or subsequent treatment of the patient. Antihypertensive if the patient is taking, antidiabetic if the patient is taking it. Contraceptive pills are also very important to be asked about. Hormonal replacement therapy is important. Drug history of allergy is very important because if we are giving same medication again to the patient, it may lead to complications. To any medicine or diet should not be missed. That is history of allergy. Personal history is also very important, whether the patient is smoker, whether he is she taking alcohol, diet. So, what is the kind of diet she is taking or he is taking? Marital status also plays a role, and women additionally menstrual history to be taken. In this includes history of miscarriages, history of cesarean section, discharge per vaginum, etc. Family history is also important. Many diseases occur to run in families like hemophilia. Hemophilia is a disease in which there is injury and blood is denying to stop. Tuberculosis, diabetes, carcinoma like CA breast. In children, you know that by now, history of immunization is very important and should be taken. If you like the video, I will again emphasize, press the like button, share the video, subscribe to the channel and press the bell icon to get all the updates about the new videos. Thank you so much. Thank you so much. Thank you so much. Thank you so much.